So Tay's a middle-aged patient, and she works out all the time in the gym. She's trying to really develop her upper body, her biceps, her triceps, and her deltoid. But no matter how hard she works out, she can't really define those muscles. So what we're going to do today is help her to accentuate those muscles, namely deltoid, biceps, and triceps. And what we're going to do is Vaser High Definition Liposculpture to define this V of the deltoid and to define that area between the biceps and the triceps, and to also get rid of a lot of the excess fat on the back of the arm and the triceps region. Also going to do some liposuction in the lower neck. She has a little bit of fat in that area.
So what this patient wants is more arm definition. She works out a lot, and you can see the hints of the deltoid in there, the hints of the biceps and the triceps back here on both sides, but she wants even more definition. So what I need to do is sculpt out the insertions between the muscles to define the intersects between the muscles. We're really not going to debulk the muscle, we're going to debulk the space between the muscle. So what I need to do is define the triceps in there and define the triceps in there. And to achieve that, we're going to use this Vaser to melt the fat, also heat the skin to really define that muscle belly in there. Also going to define the distal portion of the biceps in there, and also going to clean up the back of the arm in there. I'm going to do that on both sides, in here, like that, and to really help define our muscles both posteriorly and anteriorly. So that's going to give her a much better arm shape. So on the front, what I really want to do is I want to define the space between the biceps and the triceps to really create and accentuate that groove right in there. Distally around the biceps, we want to accentuate this groove. And in the triceps region, you really just want to clean it up, especially on the females. Now this patient doesn't want to be totally ripped, but just a little notch underneath that. So we're not going for a 10 out of 10, we're going for maybe like an 8 out of 10 in terms of muscle definition. So we're going to get both proximal bicep here, distal biceps here, and then clean up the triceps region in here. So let's go to the operating room, I'll show you how we do it.
We're doing Vaser High Def Arm Liposuction. And this patient works out a lot, but she can't get the arm definition she really wants. So this is going to sculpt out the insertions of the muscles in the upper arm, specifically the deltoid, biceps and triceps, and make her muscles really pop. So the Vaser is really good because it melts the fat, and then for me anyway, it heats the skin and allows the skin to shrink wrap around these muscle bellies that I help to define. And it's really good, like the best instrument for the upper arms when you're sculpting out the muscles. I'm sculpting out the triceps, and this will get rid of the fat on the triceps. And because of her age and her health and her weight loss history, not a significant amount of weight loss, the skin should shrink wrap nicely around her arms. So I'm approaching almost 2 minutes on the triceps region in here. I floated in about 300 cc's of tumescent fluid, and we're halfway there on the triceps. And the Vaser just really melts, and it melts the fat sort of like butter, or it turns butter into margarine. Really, really soft, liquefies it. Sometimes you'll see it come out of the ports because it just is so liquefied and emulsified with the ultrasound. Again, the Vaser works on ultrasound. Basically, that's how it melts the fat. Exactly. So with the Vaser, it's just an intermediate step. All it does is melt the fat. But then you got melted fat in your arm or wherever the body part. And you got to get that fat out.
2, 1, stop.
So that's why you've got to come in after the Vaser and then suck out the fat. So I'm done with my Vaser. I did the triceps region. I did the space anteriorly between the deltoid and the biceps, and the space posteriorly between the deltoid and the triceps and the posterior portion of the biceps. So now, since I've melted the fat, heated the skin, I'm going to go in here and scavenge and remove the fat. So we're done with the arms here. I did excellent liposuction back here. You can see there's no wiggle of excess skin, nice and tight, no excess fat. You can see the excellent definition of the inferior portion of the deltoid and then anterior of the deltoid. Here we have the biceps and the triceps. But I think she has an excellent result. You can see the definition in there, and then when she flexes, boom, look at that, she's got guns. So nice deltoid here, goes down, nice and skinny in here, and then goes out into the biceps and the triceps. Exactly what she was looking for. And then it comes around and sweeps around this proximal portion of the biceps right in here to chisel that out, and we get this nice ridge, this nice bump to define the deltoid right in here. So we're progressing, and we're onto the neck now. So now I'm just working on the chin, and she doesn't have much fat on the chin, but enough to do a little bit of spot lipo here and get rid of this little waddle of skin, which is very common in a lot of people. Hard to exercise this area away. There are a lot of patients who lose weight, and unfortunately they are stuck with this area of fat underneath the neck and in the chin region. And unfortunately there's a bias, a stigmata, you know, when you look at somebody and if they have a fat neck, you may automatically assume that they're obese, whether they are or not, just by looking at their neck. So we're kind of stuck with that bias, so to speak. So it's a good idea if your neck bothers you and you don't have a lot of skin laxity to consider this neck liposuction, which is a relatively benign procedure. Means it's pretty straightforward. The recovery is about maybe about a week. You wear the chin strap for about 1 week all the time, and then about a week for 12 hours, and that's about it. And the results usually are very, very good. I use the spatulated tip cannula. There's a lot of stuff in here, big arteries and big veins and a lot of your windpipe and all kinds of important anatomy. You got to know what you're doing, right? But the spatulated tip minimizes the trauma to the nerves that are in here too. Also concerned about 2 major nerves in here, among other things. On this neck, I didn't do Vaser. I just did tumescent and then the lipo, which is what we call traditional liposuction. 2 steps, tumescent and lipo. With the Vaser, it's 3 steps, tumescent, Vaser, lipo. And on this neck, I didn't think she really needed the Vaser. It's relatively mild. So there we have it. We did Vaser high definition of our arms, which looked fantastic. It's exactly what you wanted. Really good sculpted out arms. Also, I did an excellent job on her neck. Nice chiseled 90-degree neckline. Now we're going to get her in her garment and out to the recovery room. So thanks for watching, and we'll see you next time. Goodbye.